Hi, my name is Maria Escobar, and I'm here again with MedEdge interviewing these amazing people. And today I have someone all the way from Spain. Today, actually, I also have the pleasure to speak about pain management, and for that, I have the expert. Hello, doctor. How are you?
Oh, listen, friend, thank you so much for to stay here with you. I am fine. I am fine.
Perfect. Thank you. Okay, so you were talking about a topic that I think everyone wants to know, right? Everyone wants to go for the beauty and do everything that is done. But what about the pain that, it creates all these beautiful procedures? And you were talking about pain management. Tell
Yes.
us about
I am an anesthesiology, expert in pain management, regenerative medicine. Um, I use many products that many people use in the aesthetic procedure, but I need to restore the functional problem of my patient. Remember that the risk of the beauty, no? You want to do any procedure for aesthetic, and after that, you have a big problem.
Yes.
Yeah,
Pain.
the pain and maybe the acute pain or maybe the chronic pain. Yeah, I need to treat not only the structural area that suffer damages, I need to treat the nerve, I need to treat the functional, I need to treat the brain too. And for this reason, in this moment, we are applying different kinds of treatment. For example, regenerative medicine, electrostimulation, maybe magnetic and current stimulation, or maybe we need to treat the autonomic nervous system with different device. But in this moment, we use one revolutionary treatment that is the exosomes, autologous exosome for to treat the pain that suffer the patient after the procedure, the aesthetic procedure. And I need to put through the skin and to inject inside of the body. And I prefer the autologous because for example, in Spain, is no the regulation, the rule is not good that you put inside of the body the heterologous exosome or cosmetic exosome. And in this moment, I use autologous exosome. I obtain the blood of the patient, and after the process, immediately I have a autologous product for to put inside of the body. And this is easy and this is safety for the patient. And the mechanism of action is to obtain the one response very fast for to obtain the best results. Is a kind of regenerative medicine for to prevent the oxidative stress of the area. And this is more important.
Perfect. So everyone is speaking about the exosomes, and it's very fascinating because obviously everyone's talking about it for beauty. Now you're talking about it for pain management or recovery. So explain to us how the exosomes work. Like, what is that it does to the body? So it helps so much with everything.
Normally, in my case, I have experience in the last 20 years with the use of the regenerative medicine. We started 20 years ago with the use of the bone marrow, stem cell from bone marrow, and after that, the stromal vascular fraction for FAC. And I need to create one specific treatment fast, very rapidly, because it's not easy for one aesthetic procedure that you need to open one hole in the iliac crest or maybe in the tibial bone, no? Or maybe you say, no, I need to put one special fillet, I need to make one mini lipo, no? The patient says, yeah, really? I need to do these procedures before from after to obtain any satisfactory resolution. And with the exosome appear in the for the company show us the exosome, you have the exosome in the bottle, and you obtain like a drug for to use rapidly for to control any disease. And for me, the big surprise, I commend for my student, for another doctor, that the big surprise for me is to fast action of the exosome. Because sometimes when you put PRP or maybe a stem cell from bone marrow or from a stromal vascular fraction, you need to wait more or less 4 weeks, maybe 1 month, maybe 2 months for to obtain the best result. And maybe you need to repeat this kind of treatment. But with exosome, it's totally crazy because you obtain the result maybe after 72 hours.
Oh, that's good.
Yeah, it's right. Imagine that the patient suffer, in my case, for like specialist in pain management. If the patient suffers one neuropathic pain, and you have very, very, very intensive pain, and I put the exosomes around the nerve, and the action of the anti-inflammatory effect, you obtain this anti-inflammatory effect in only 72 hours.
That's crazy.
It's crazy. It's crazy. It's amazing. It's very impressive for me, and it's a big surprise for me because we combine in our surgery room, we combine different energy devices. Imagine that I use invasive radio frequency for the attenuation of the pain. But when you combine the regenerative medicine, like exosome, with spot action, with the radio frequency, you obtain the better result in only.
This is very expressive. This is very good. So definitely something that everyone needs to know. Can the exosomes be used for all kinds of pain? Is there all?
Because you tend, for example, the exosome have growth factor, cytokine. If you take the best is that is the imagine that you have one cell here and one cell here, and the exosome is the email, the fast communication between two cells that need to do any action.
Yes.
And normally, is you have one slowly communication, like imagine normal PRP, you need one width for two communication between cells. And with exosome, you say rapidly, fast, and the action is in only many little time.
Perfect. And we're talking about exosomes here into this conference.
Yeah, in this conference, we have two lectures. One lecture specific with the use of the regenerative medicine and energy device for to treat the pain after the aesthetic procedure. And yesterday, I was one important lecture for the use of regenerative medicine in the pelvic floor, because I am a specialist in pelvic floor, not only for aesthetic, cosmetic in the urogenital area, because we use the exosome and different energy device with a magnetic field or shortwave for to prevent the erectile dysfunction or clitoris dysfunction, because it's possible to use the exosome in the clitoris area or in the penis for to recover the functional of the penis.
Would you say the exosomes have really revolutionized?
It's revolutionary. It's revolutionary. We think that the revolutionary drove was in the past the cytokine, but in this moment the exosome is the best in this moment. Yes, it's amazing.
Now tell me, Dr. Ernesto or Professor, which one you rather?
So for you.
Okay, thank you, Ernesto. What have you liked about this conference the most? Like, what is the thing about 11 edition of AIDA that you
For me, it's a big surprise because it's my first time here. Knowing Abu Dhabi is in the AIDA conference, and it's a big surprise. It's possible for me to share with all of doctor, student, company for to elevate my quality formation of knowledge for to apply in my patient. Remember that the gold standard is to increase the quality of life of our patient. And for the reason is a good option for us, for the professor, for the student, for the attendant, for everyone that they need to open their mind for to use the different category of treatment or device. That's more important this congress.
So being this the first time, has the conference exceeded or is being within your expectations?
No, it's totally my expectation is very, very high with this conference, and I am very happy after the participate in this conference.
So we hope to see you next year?